My case study is number 3. She's a 34-year-old female named Sheila. She sprained her left ankle while she stepped in a hole on a pavement wearing high-heel shoes. It was over 3 weeks ago, and she has come to us to get back to day-to-day life because she's been feeling a lot of pain and soreness in her ankle. So we're going to do a range of motion test for right and left foot for plantar and dorsiflexion, and then we're going to do a strength test for both ankles on an Oxford scale, and then we're going to demonstrate and prescribe some strength and stretching exercises to her. So we'll be performing range of motion on the left leg. First we will do plantar, and then we will do dorsiflexion. We will start at a 90-degree angle. We get 3 points. Pivot is at the lateral malleolus. Proximal is at the lateral aspect of the fibula, and then the distal is at the 5th metatarsal. So we're going to place the goniometer there, and we're going to ask them to move the foot away from their body as far as they can. And whenever you're ready, and we have an angle of 20 degrees. So now we'll be doing dorsiflexion, so same points, and we're going to ask them to move their foot towards their body. And whenever you're ready, and we have an angle of 5 degrees. And now we will be doing our plantar angle for the plantar and dorsiflexion for the right leg, which is not injured, so we'll probably be seeing more range of motion in the right leg. So we will ask them to do the same thing, to move their foot away from their body and keep going as far as they can until they can't do it anymore. And we have an angle of 40 degrees. So now dorsiflexion for the right foot, same points, and we're going to ask them to move their toes towards their body as far as they can. And whenever you're ready, go. And that's it. And we have an angle of 10 degrees. So now we will be doing strength assessment using the Oxford scale. So a 0 will be awarded to the client if there's no muscle activation against the resistance, and 5 if there's a full activation against the resistance. So first we will do with the not injured leg, and we will ask them to resist against our hand and do a dorsiflexion. So that's pushing their toes towards their body. So whenever you're ready, push as hard as you can. So yep, and that's pretty good a muscle activation, and they're resisting against my hand, so I will award them a 5. And then now I'm going to ask them to push against and do a plantar flexion, and that's moving their feet away from their body. And whenever you're ready, as hard as you can. And yep, and there's a full activation against the resistance, so I'm going to award them another 5 for the right leg. So now we will be doing on their left leg. So the client is laying down on this side so that there's no role of gravity when they do a plantar flexion. So again, first going with the dorsiflexion and moving their feet towards their body against my resistance with my hand, and whenever you're ready. So yeah, there is not much movement, there's not much resistance coming from their feet, so I will award them a 1. And now in a plantar flexion, again, we'll ask them to move it away from their body whenever you're ready. And there's a little bit movement coming up with the plantar flexion, so I will award them a 2. So first we're going to do some stretching exercises, then move on to the strengthening exercises. So on the injured leg, we're going to start with ask the client to hold a band around the toes and hold it and stretch the toes towards the body and hold it up there for 10 seconds and then release, and then again push it towards the body and hold it for 10 seconds again, and that's it. Okay, for the next exercise, we're going to ask the client to hold on to something and stand in this position where they're stretching their toes away from their body. Ask them to stand there for 10 seconds and then have some rest and switch the leg. Okay, so now the second stretch for the ankle is we're going to ask the client to cross their leg, put their left leg on top of their right knee. Yep, and then they can hold their one hand down on the side and another hand on the top. And then we're going to ask them to pull the toes away from their leg and then hold it there for a few seconds and then let them go. And then they can stretch it one more time, hold it there for 10 seconds and then relax. So now we're going to do some strengthening exercises. First one for the heel is heel raise. Our client can stand next to something so there's less chances of a fall. So I would like you to lift your heel up from the ground slowly and as far as you can onto your toes until it starts to hurt or you can't do it anymore, and then relax back. And then you can do it one more time up and try to hold it there and then come back, and that's all. Okay, so now the second exercise, we're going to ask them to be in a straight leg seated position. So this exercise can be done with someone assisting or by themselves. So we're going to use a band and we're going to put it against the toes, and we're going to ask them to do a dorsiflexion. So that's pushing your toes towards your body against the resistance. So whenever you're ready, you have to push it up slowly, hold it, and then let it go back. And then push it up again and let it go back. And that's it.